We are here with Matt Davidson and Jules Stanley here at the University of Kentucky Medical Center. We're discussing the interview process and what we look for in quality employees. This is for our Eastern Kentucky University EMS management class. So, Matt, what is the interview process like here?
It's pretty straightforward. So you put an application in here. Once the application process closes, we get your resume and any other information that you included in that. We give you a call, set you up with an interview, and then when we come in here, we try to give people a good overview of what the job looks like here. It's a lot different than most EMS jobs. So we do that first, and then we get into a more formal interview where we ask technical questions. We ask about how you get along with coworkers, things of that nature. And then after the interview, we then give them a tour as well to make sure they have a very good picture of their role within the hospital. And then after the interview, you will follow up about a week later and let them know how we're going to proceed.
So, Matt, what do you look for in a quality paramedic?
I think there are a lot of the good things to look for. One of the biggest things we look for here is to make sure that they're going to be a good cultural fit. We want to look for people who aren't going to be a bunch of drama here. They don't want to stir things up, but they want to help us improve and progress in the industry that we're in. We also look for people who are kind of self-starters. In the ER here, you have to be proactive and do things without being asked. So those are some big traits we look for.
Okay, and Julius, you are a lead EMT. What are some quality characteristics you look for in your EMT?
A lot of things mix over with paramedic, like Matt said. However, we really like the low drama people that are going to come in, be A players, take everything that they do and keep it going, not try to rely on everybody else to do their job. We like to have people that have experience. However, we do offer a good orientation process to try to build people up and give them all the tools that they need in order to be here.
What does the EMT orientation process involve here?
We start you out, it's typically 3 weeks. However, at the end of that 3 weeks, we do not automatically take you off orientation. If you, your preceptor, or myself feel that you need more time, we'll continue your orientation process. Those 3 weeks typically consist of 3 days each week. You'll get 3 days on the LCT, which is the lead dispatcher. You'll get 3 days on the adult truck, and you also get 3 days on the baby truck.
All right, and Matthew, as far as paramedics here, what does their orientation consist of?
We've recently expanded our orientation quite a bit. So our orientation lasts generally a minimum of a month. So we spend a significant amount of time with our paramedics, both on the truck and in their roles in the department. We've also recently expanded our orientation to spend a significant amount of time with the nurses out in the department. A lot of the skills that our paramedics do here in the ER are things that they don't really do much in ambulances. So in order to facilitate a little more learning, we put them with the nurses who that is their main role day in and day out, so they can get a lot of experience. Same as the EMTs, at the end of the 4-week mark, we always assess and see where people are. If they feel they need more time or we feel they need more time, we'll continue them on orientation until we feel they're competent and confident in their skills.
All right, and how long have you been with the organization, Matthew?
I've been with here UK for about 2 years. 1 year as a paramedic and then 1 year as the paramedic supervisor.
And Julius, how long have you been with the organization?
I've been here at UK a little over 4 years. I spent about a little over 3 back in dispatch, and then I've been in this role for about 8 months.
All right, gentlemen. Well, thank you very much for your time today.